Will demons change the brain structure? I'm Dr. Anthony Collada. I'm a board-certified psychiatrist. If there's any medical field that has a blurring line between the spiritual and the physical, it's going to be the realm of psychiatry. Because so much of psychiatry deals with how one's thoughts and emotions, and so much of spirituality also entails one's thoughts. And it's often believed that the devil can start attacking people by their thoughts. So what do we know causes these brain changes that people go through and might make them more predisposed to suffer from mental illness or mental health problems? Part of the brains won't fully develop until people are age 25 or so. In particular, the part of the brain called the prefrontal cortex, which deals a lot with decision-making, planning, organizing. And even over the years, the brain is very adaptable or plastic, meaning the neurons and the receptors can change over time. And these connections can continuously get sort of rewired and reconnected through various means, whether it's training the brain, therapy, using skills, exercises the brain. Well, starting from an early age in life and as one develops, we know that their environment plays a huge role on how their brain develops. Now, how do we know this? Well, if you take a fetus in the mother's womb and the mother is very stressed, you know that the fetus, when they grow up in life, they're going to be more stressed as well because they sort of grown up in this stressful environment in their mother's womb. In fact, there's thought to be genetic changes that happen, what makes them more predisposed to stress later on in life, just because they grew up in a stressful environment in the mother's womb. So the kind of upbringing one has, or the type of caregivers they lived with, the security and comfort at home growing up, plays a huge role on one's mental health later in life, how they get along with others. Now, assuming one had a relatively normal upbringing as far as like genetically, their delivery, reaching all their milestones on time, there's a lot of other factors you can look at that can change brain structures. One is the genetic makeup of people. Typically, like medical conditions can get passed down through families, so can mental health conditions. And some people may be more hardwired to suffer from some diseases than others. And so someone's brain also may be hardwired based on what is passed down genetically. If someone is using like substances like smoking or using drugs, that can cause brain changes as well. In particular, alcohol can damage parts of the brain called the mammillary bodies, and people who use a lot of alcohol are more likely to get dementia at younger ages. Also, people that use methamphetamines can also get dementia at young ages. They may also be more likely to have strokes. So those substances can play a role on one's brain development. And I would go a little bit further to say just nutrition in general. Nutrition is an important part of one's health and well-being, and it may play an important role as well in one's brain development. And just like a lot of stress in someone's early life can affect their brain development, someone's stress in their adulthood can affect it as well. How much is one sleeping? Are they taking care of themselves by getting adequate sleep? Are they exercising? Living a more active lifestyle to try to be physically healthy, because the physical can affect the mental and so forth. Do people have untreated mental illness? Like, are they having depression or anxiety that's untreated? Because that can affect the brain structure and how the brain is performing. Has one been predisposed to a lot of illnesses or infections? Even if someone was young and they've been predisposed to a lot of infections, that may affect the brain development later on in life. Are people on medications? Medications like prednisone or steroids can affect the mental health and the physical health. And so there's many things just physically that can affect the brain structure. Well, what about spiritually? Can spiritual stuff affect the brain structure? So interestingly, according to psychologytoday.com, approximately half of all U.S. adults believe in demonic possession. But clinicians are trained to see the problem as a scientific or physical problem, maybe a neurological or psychological problem, and not a spiritual problem. On the other hand, many people who believe they are demon-possessed are actually suffering from a mental illness like a psychosis or a bipolar disorder or something like that. For example, hearing voices or auditory hallucinations can be a sign of bipolar psychosis or schizophrenia. But many people suffering from these will not take medications because they don't see it as a physical or mental problem. They see it more as a spiritual problem. And this concept of good or evil, or good versus evil, is not a scientific concept. It is entirely spiritual and moral concept. And so many thoughts can come into one's mind about this dichotomy or this challenge or conflict between good and evil. But that in its nature is more spiritual. Yet when someone comes to a social worker or psychologist or therapist and are dealing with these thoughts, the clinician has to deal with it in a scientific way, saying, okay, this is a thought you're having, it's causing this feeling, which leads to this behavior. So you got to fix the thought to fix the feeling to fix the behavior and so forth. So in essence, mental health treatment may not go into this nature of good or evil, although the problem and the distress that people are going through may be in its entirety the spiritual concept of good versus evil. But both in spiritually and psychologically, it's often recommended to try to push off some of the thoughts. Don't put too much attention to your thoughts. Don't dwell on them. Don't ruminate on them. Because oftentimes we are not in control over our thoughts. In Christianity, oftentimes as one grows closer to Christ and grows spiritually, the devil is going to plant thoughts to harm the person, or thoughts from jealousy, or try to get them away from God. And then psychologically too, a lot of times people will get thoughts like they worry too much, or they worry that the worst is going to happen, or maybe they had a traumatic experience, so they have a hard time trusting people. And so there can be a lot of confusion or commotion just based on the thoughts we're having. So we really got to be attuned and be mindful of what thoughts you're having so that they don't sort of engross or take over one's emotions and behaviors. But there are many mental health conditions, even some physical conditions, that can come across as demonic possession or religious war or something along those lines, and it may be entirely a mental illness. On the other hand, for some people, there may be some demonic possessions and spiritual challenges that they're going through, and they don't get it treated by their faith or the religious community, and they go to a clinician such as myself to get it treated. And as a clinician, I can suggest they go to the religious community and so forth to get it addressed, but I really have to use a combination of medications and therapy or to help solve the problem that they're going through.